Good afternoon, ladies and gentlemen. Welcome to this new episode of Medcast, your new gateway to the latest medical updates and the rumors we have in society. Polypharmacy refers to the use of multiple medications by a patient, particularly in older adults. While it can be necessary for managing complex health issues, it also raises concerns about potential drug interactions, increased side effects, and medication non-adherence. That's why today we are so pleased and honored to have Dr. Nasser AlQuraini, who is consultant in family medicine, geriatric medicine, palliative care, and geriatric oncology. Welcome, Dr. Nasser.
Thank you so much for having me.
We are so pleased and honored again to have you again in our studio.
Thank you.
Dr. Nasser, as you heard in the introduction, that polypharmacy is so vital, especially for the older people. So how come polypharmacy is becoming significant these days?
So because, as you mentioned, the older adults, they usually associate or having multiple comorbidities or multiple chronic diseases. Usually we see anybody after the age of 65, they usually have one or two chronic diseases, like the diabetes or the hypertension and so on. So by increasing with age, at least the elder will be having at least the least will have 5 to 6 medication. So the thing is that with multiple medication, it will just keep add on because the elderly will have multiple specialties that they usually follow up with in the hospitals, and sometimes they will have some over-the-counter herbal or supplementation. Yeah. So that will create the problem of polypharmacy. Usually have a patient in the clinic have a list of 8 to 13 or 15 type of medication, which they sometimes forget they are using it for which indication. So it's coming a very prominent issue in geriatric medicine.
That's very great. And as well as, if you remember in the previous episode, you have mentioned that geriatric medicine has been recently introduced to Kuwait. Yes. The reason why you have now a specific geriatric medicine, field in the medicine, because as you say, they might have multiple complex indications that would lead to use the pharmacy. But what we need to know is what is the risk of having polypharmacy or multiple medications at one time?
So we have at first the drug interaction. Usually multiple medication will have usually associate with cognitive impairment. So having so many medications, especially the pain medication or the antihistamine that we usually have it over the counter without prescription, will increase confusion and memory loss in the elderly. Also, pain medication will usually cause some nausea, some constipation issues, and have some difficulty. with ambulation. Usually, the elderly will have the pain medication, and they will suddenly stand up or wake at night for using the washroom, and they will have the fall. So, multiple medication or polypharmacy associated with increased risk of falls, and then. Sometimes having multiple medication will have counteracting effect. By having one medication, it might block the effect of another medication. Medication. So it usually associated with increased risk of ED visits, admission to the hospital, sometimes admission to the ICU. So it might also increase the risk of mortality.
Okay, that's great. But sometimes some patients would ignore the importance of the interactions, and they might think the interaction only can happen with the drug interaction. But somehow we do have as well the drug-food interaction. How important is that to an older age patients?
It's very important. So this is why we should usually have in our geriatric team, we have a clinical pharmacist, which is a very important member of the team, to explain to the elderly person how to take his medication, when to take his medication, when to associate this medication with food, and when have this gap between having this medication and the food. Like for example, having warfarin. So having warfarin, which usually with some type of food, like some green
grapefruit and the green leaves.
The green leaves. We need to monitor that with the patient on warfarin. So food is very important with certain medication. So this is why we have to be paying attention. Usually, the clinical pharmacist will explain in detail for the patient or usually the caregiver when to have those medications.
Okay. In addition to the importance of of the drug-food interactions, some patients as well from the older age might believe that the herbal medicine might give them the treatment they would or they are looking to. So they would decide leaving the medications in order to consume the herbal medicine. How would you comment on that?
I'm so glad that you mentioned this point, because usually we have this public understanding that herbal medication or supplementation will be safe, whatever it is, and we can combine it with any medication, which is absolutely the opposite. For example, because my practice in geriatric medicine, I have encountered a lot of patients or caregivers will bring me some supplementation that they think that it might improve the memory or it might improve the cognition.
Especially with the omega-3, because they are emphasizing the use of omega-3.
Thank you so much for bringing this up, because omega-3, the public have this understanding that omega-3 will have tremendous benefits and tremendous effects on cognition, which most of the time it's a myth. So having omega-3 or having the ginkgo biloba, which interact with anti-platelet or anticoagulant. So having supplements with medication maybe have drastic complication and effects and the elderly. So it's not usually safe. It's not monitored or it's not regulated. So I would refrain from having any supplementation without having a consultation either with a physician or with a clinical pharmacist.
Now, the problem is that some individuals might believe that these herbal medicines, if they are not safe, let's say, or not giving you the benefit you are looking for, they might not be harmful as well. But because they are coming in a specific dose, you might have an overdose, as simple as I can say now, because sometimes they say if it's a natural source, they can take as much as they can, but this is a very wrong idea. As well as the supplementation, some people might think that relying on physical activities or changing lifestyle would also help than taking medications. Let's say, as example, in reducing the levels of high blood sugars, they would say, I will not start on medications and I will not be in need of following up with a doctor or physicians. I will just change my lifestyle. Is that right or not?
Well, actually, we usually will base our clinical decision based on the guidelines. So if with the clinical workup and with the investigation, we usually start prescribing medication based on those specific objective measures.
Yeah,
I would usually we start with the non-pharma approach, but if we need to use the pharmacological agent, we definitely will use it. But leaving, the clinical decision based on the patient themselves, and they decide without, based their decision on the guideline, that I guess sometimes will be harmful to the patients.
Let's have like a quick case, and imagine yourself, you are in an OSCE exam now. If you have a patient now with HbA1c of more than 15%, would you start giving them an advice to change the lifestyle or start immediately with the medication?
Usually I start with the lifestyle medication.
Even with the 15% HbA1c?
HbA1c, it depends, of course, on the age and other risk factors and family history. So it differs from one case to another case. I will take it case by case, but a significant increase with like 15 and above. Definitely, it's diabetes. It's a major microvascular disease and it's metabolic disease. So I would usually base my clinical judgment after taking all those factors. Definitely, I will. The best interest of the patient definitely will start with some agents.
Well, that's why I'm always saying with my colleagues, the doctors, that medicine is not as simple as the people might think.
Exactly.
Because they think it's like a mathematical equation, which is 1 + 1 = 2. If I have this, I would go for that medication. You need the judgment of a or a physician or a medical professional to help you to improve your life or at least maintain a healthy lifestyle. Now, regarding that, how would you educate the caregivers and the patient themselves about the polypharmacy and the unverified supplements?
Usually, with each medical appointment, I will review the patient medication. Even if I prescribe the medication, I will review the medication. I would look after. I will be asking about the side effects, adverse events, the benefit of those medication. If there is no benefit, usually gradually I will titrate down the medication and stop it. I review other medications that are prescribed by other specialty. If the indication is still persist, I will continue with the medication. But if there is any chance of stopping the medication, I will stop. If there is any chance of I improve or adjust the medication, I will do that for sure. And usually, I will regularly follow up the medication. I will ask the clinical or the caregiver or the patient themselves to keep track with their appointment, with their doses, with their timing, and keep records of each medicine and who prescribed the medication and for what indication.
And I know sometimes it's a struggle to follow up like in a regular basis of timing, like throughout the year. If you ask the patient to come every 3 months, some patients might ignore the appointments and might come after 1 year with a very big deterioration of their case. Now, the point is, you remember when you spoke about the ginkgo biloba, I wanted to add some information, a quick information, as my role as a pharmacist. Some people don't know that ginkgo biloba, despite being from natural source, it's not recommended for people over 65 years old.
Exactly.
So being a natural medicine or natural supplement doesn't mean it is safe for everyone.
Of course.
And that was my last edition of our end of the segment, if you don't mind, Dr. Nasser. And we are so pleased to have you today. Hopefully we can see you again here in the studio.
Thank you so much.
Thank you so much. Our dear viewers, we have reached to the end of our segments of Medcast. Hopefully we can meet you again with another medical professional. Until that time, see you later.